Having a couple of drinks can be a fun and exciting time with friends or family. However, if drinking starts to seep into other aspects of a person's life, it can become alcoholism, also known as alcohol use disorder. AUD is one of the most prevalent substance use disorders around the world, and in the US alone, over 14.5 million people experience it. The therapeutic potential of hallucinogenic drugs has sparked widespread interest in its use. Studies are finding psychedelic therapy could reverse debilitating effects of depression, anxiety, eating disorders, and PTSD. Now, it remains to be seen how this could translate to alcohol use disorder, but wouldn't it be great if it could help these people too? Hi folks, my name is Cole, and I have a Master's of Immunology. Today on Investigate, Explore, Discover, we're going to be looking at using psychedelics to reduce drinking. So hang around with me throughout this whole video to get all of the relevant background information so we can dive into some exciting experimental results. There's also more information for you in the description below. Now, to make sure that we're all on the same page, we need to clarify some descriptions. A standard drink contains 14 grams of pure alcohol and can be found in a variety of different concoctions. According to the World Health Organization, to elevate your risk out of the low-risk drinking category, you need to consume over 20 drinks per week if you're a man, or just 10 drinks if you're a woman. What exactly this increases your risk of? It's not particularly clear, but perhaps it refers to the overall risk of problems? And unfortunately, the problems are not hard to find, and don't just affect you if you drink more. This can manifest as increased personal physical pain and problems with intra and inter-relationships, coupled with decreased social responsibility and impulse control. Addiction requires a compassionate approach. To paraphrase Dr. Gabor Mate, addictions begin with solving a problem, and the problem is that of emotional pain. So the first question is not why the addiction, it's why the pain. For those that recognize their drinking is causing problems for them, there are multiple treatment options that include support groups, behavioral therapy, and possibly medication. These resources are sadly underutilized, as just under 7% of people fighting AUD received treatment for it in the past year. So why might this be? Are people ashamed? Not finding it too much of an inconvenience? Or are the treatments just not that good and prone to relapse? For those seeking treatment, effectiveness will depend on the extent to which drinking risk factors are targeted, as well as the personal resources that each individual brings to treatment. In terms of medication, several are already available to help reduce drinking, but these need to be taken frequently and may have unpleasant side effects. The past 2 decades have witnessed growing interest in the clinical potential of psilocybin and other classic psychedelics to treat neuropsychiatric conditions, including substance use disorders. The Harris poll reports that nearly 2/3 of Americans who suffer from anxiety, depression, or PTSD believe that psychedelic medicine should be made available to patients that are treatment resistant, which is a lot. It has been shown that psychedelics aid in the treatment of anxiety, depression, and PTSD by exerting a positive effect on neuroplasticity, dendrite growth, axon branching, and synapse formation. Although the exact physiological mechanisms of psychedelic-assisted treatments remain unclear, the enhanced brain plasticity at multiple levels, which affects neuronal structure, neural networks, cognition, and behavior, are worth taking a closer look at. Lysergic acid diethylamide has already been proven useful for treating alcohol use disorder. In 6 randomized clinical trials published between 1966 and 71, it was revealed that participants with alcohol dependence treated with LSD demonstrated remission during follow-up nearly twice as often as those in comparative conditions. Psilocybin, the active ingredient in magic mushrooms, works on the brain by activating the serotonin 2A receptor. This causes the release of dopamine, psychoactive and hallucinatory effects, as well as increased neuroplasticity. As with most drugs, the more you take, the more intense the experience that you have. An average recreational dose of psilocybin is usually between 20 to 40 milligrams, or about 2 to 4 grams of dried mushrooms. Furthermore, the experience of having a moderate dose of psilocybin can induce a profound and transformative spiritual or mystical experience, which can lead to lasting changes in attitudes, beliefs, and behaviors related to substance use. This suggests that psilocybin may be particularly effective in treating AUD and other substance use disorders that are driven by psychological and spiritual factors. In fact, picking up on the line of research following LSD 50 years ago now, An open-label study published in 2015 demonstrated that moderately high doses of psilocybin were well tolerated by participants with alcohol dependence, and large reductions in drinking were observed over a 32-week follow-up period. The study that we're looking at today follows up on this line of research, and furthers the line of questioning by not just asking if it is safe, but does psilocybin-assisted treatment improve drinking outcomes in patients with alcohol use disorder relative to outcomes observed with active placebo medication? Now, I want to take a moment and really highlight why researching the therapeutic effects of psychedelics is so important. Over 14.5 million people experience alcohol use disorder. Although classic psychedelic medications have shown promise in the treatment of alcohol use disorder, the efficacy of psilocybin remains unknown. Thus, studying the use of psilocybin to treat AUD would provide valuable insights into the mechanism of action of psychedelic compounds and the potential role of spirituality and transcendent experiences in addiction treatment. If you also think that these are some important reasons to research this topic, go ahead and tap the like button. This brings us to the paper that we're focusing on today. This paper is called Percentage of Heavy Drinking Days Following Psilocybin-Assisted Psychotherapy versus Placebo in Treatment of Adult Patients with Alcohol Use Disorder, a randomized clinical trial by Bogenschutz et al. From New York University, Grossman School of Medicine in New York. In this paper, the authors evaluated the effectiveness of psilocybin-assisted therapy for the treatment of AUD and reported the drinking outcomes over the course of 8 months. For this study, the authors enrolled a total of 95 adult participants, aged 25 through 65, at the University of Mexico and New York University. They would have recruited more, but the COVID-19 pandemic caused them to shut registration early. At baseline, the participants were drinking 3 out of 4 days, and drinking heavily every other day. On drinking days, this averaged 7 drinks per day. They also had a number of problems related to drinking, like physical pain, inter- and intrapersonal problems, poor impulse control, and decreased social responsibility. For the trial, patients were randomly assigned in a 1-to-1 manner either psilocybin or diphenhydramine, allergy medication. Both groups received psychotherapy before and during dose administration. The trial itself lasted a total of 36 weeks. All participants were offered 1 to 2 hour psychotherapy sessions once a week for the first 12 weeks from 2 therapists. However, when given a medication dose at weeks 4 and 8, the session lasted 8 hours. 25 milligrams of psilocybin was given per 70 kilograms of participant weight for the first dose, and if there was no dose-limiting adverse events and the participants agreed to the increase, they were given more on the second dose. Now, the study was meant to be double-blinded so that no one would know what was given. However, when both the participants and the doctors were asked to identify which treatment they received, over 90% of them correctly and confidently identified the treatment given to them. From study recruitment, where people were drinking 75% of the time, with just the use of psychotherapy before any dose was given to people, the participants already saw a decrease in their World Health Organization risk level, namely by reducing the number of drinking days, heavy drinking days, and drinks taken. After being given diphenhydramine, the participants maintained this reduction in their drinking days to 2 out of 5, and heavy drinking days to 1 out of 5. The average number of drinks they took was also reduced to 2. For those who were given psilocybin, these participants drank 30% of the time, and drank heavily only 10% of the time. On average, the people in this group consumed 1 drink per day and had higher levels of abstinence and no heavy drinking days during the last month of the study. Psilocybin administration was also associated with temporarily increased blood pressure and heart rate. And during the 2 days after dosing, participants found that they experienced a passing nausea and anxiety. Notably, after taking psilocybin, the participants experienced a decrease in many drinking-related problems, such as decreased physical pain, reduced inter- and intrapersonal problems, better impulse control, and an increased sense of social responsibility. To quickly summarize everything all together, the authors enrolled almost 100 people that were using alcohol in unhealthy ways to participate in therapy around their alcohol use and be assisted by either psilocybin or an allergy medication control. The primary goal was to see how many heavy drinking days were experienced by both groups. The authors found that psilocybin reduced the percentage of heavy drinking days by almost twice as much compared to diphenhydramine. and found that this correlated with a decrease in the number of drinking days and number of drinks consumed per drinking day. Furthermore, this correlated with an increase in alcohol-free days for those who received psilocybin. Not only do I think that the use of psychedelics for therapy is exciting to investigate and learn about, it is also significant in a broader context. This information is significant because this is the largest and most rigorous of any psilocybin trial so far, with a randomized placebo-controlled design. Psilocybin treatment was associated with improved drinking outcomes. The percentage of heavy drinking days was 41% of those given the placebo, suggesting that this is a promising treatment warranting further research. Overall, the study contributes important new evidence to the growing body of research on the potential therapeutic benefits of psilocybin and highlights the potential of psychedelic-assisted therapies as a treatment for substance use disorders. All science is basically a stepping stone for new knowledge, and these steps are driven by questions. And I had a few questions myself after reviewing this information. Though this study had a good size population, it was not large enough to gather any meaningful data about the subgroups of people involved. So how effective is psilocybin when comparing men to women, different ages, different ethnic backgrounds, or even people who also experience depression or anxiety? Because this study only went up to 36 weeks, there is no information that can be gathered about relapse or how sustainable this therapy was. So, is this a therapy that would need to be repeated? And if so, how often? Furthermore, there is always curiosity as to exactly how this effect is being caused. Will there even be a biological test that would be able to tell us the physiochemical reasons? Or is the reason perhaps more spiritual in nature, having to do with how we interpret and perceive the world around us from our own internal monologues? As always, my final question revolves around you. What sort of ideas or questions popped into your head when hearing about this information? I would love to hear about them in the comments section below. Also, let me know if there are any topics that you'd like to hear about in the future. Ultimately, I hope that you learned something. But more importantly, I hope you enjoyed your time doing so. If you did, give this video a like and subscribe for more in the future. Well, that's everything for today. Thank you for watching, and I'll see you next time.